Hey guys, how's it going? Dr. Julien. I'm the orthodontist, but I know a lot of you guys have questions about a lot of other things that's sort of beyond my realm or my expertise, which is obviously braces and Invisalign. And one of the common questions that I get usually from adult patients or in child patient who's missing teeth and things like that is about implants. And implants is not something that orthodontists usually do, but there's no like a dedicated specialty for implants. But there are general practitioners who focuses on sort of more advanced procedures, and that's why I brought Dr. Han. So he studied additional years after dental school in Germany, right?
Yes, that's correct. I'm a general practitioner, as you kindly introduced me. So I do focus my practice mainly on the field of implantology and on recent teeth surgery. I was fortunate to do my additional studies in Germany and called Masters in Odontology and got a university in Frankfurt, in Germany. And it's targeted toward general practitioners as well as specialists who want to advance their skills in the field of odontology.
So that's why I thought it'd be very helpful, useful, even for me, to sort of talk about the implants and give you guys sort of what an implant is, because I feel like there's a lot of misconceptions surrounding it, like the timing of it, what different kinds of implants there are, what are the indications or contraindications, and so forth. So yeah, let's first begin about sort of like the general aspects of it. What is an implant? Because when people say implant, they know that it's sort of for missing teeth people, but what is an implant?
Okay.
Yeah.
So before we talk about an implant, I'm just going to give you a brief history about how the implant started. So even back in the ancient days, people were interested in replacing missing teeth. So there's actually an evidence of Mayan population placing shells or jewels on the teeth into the bone of the teeth. Apparently the bone grew well around it. So that was the first evidence of a dental implant. But
I didn't know that.
It was in the 1950s, a biologist called Dr. Brennemark. He was studying the blood flow of a rabbit's leg, and he studied that by placing a titanium rod in the rabbit leg into the bone. While studying the blood flow, he found that after a couple of months that he had trouble removing that titanium rod from the bone. So that's how he found out that titanium and the bone kind of integrates to one another. That's how he introduced the concept of osseointegration, that the bone and titanium can essentially fuse. That's when the idea of dental implants kind of started. So a dental implant is essentially for those patients who are missing teeth, because if you're missing teeth, then there's no root underneath it, right? In order to replace those missing teeth, you can do it by the form of either denture, bridge, which has pros and cons to each option. But a dental implant can be one solution that can provide a good functional and aesthetic result.
So yeah, that's I actually didn't know that it was from studying the blood flow. I thought I heard of Dr. Brennemark, and then he's sort of like the father of implants, but I thought he was actually studying osseointegration for a different purpose, but I didn't know it was to study like other stuff.
Yes.
But he sort of
So
found
it was
out.
an incidental finding.
Yeah, so implant basically is like the root. Our natural tooth has two parts, the crown and the root, and the implant is basically the root.
Exactly.
And then after you place the root and it sort of integrates with your natural bone, then you need the crown.
Exactly.
Right? So they form the dental implant. Well, dental implant plus the crown.
Exactly.
Right?
Yeah.
So dental implant refers to the root then technically, right?
Exactly.
It doesn't really refer to the crown and the root, but it's actually the root part.
Exactly.
Yeah.
So as you correctly pointed out, so the actual dental implant is the titanium root, so which we call it fixture.
Texture.
And as we previously mentioned, the titanium and the bone fuses. So once we place the titanium root into the jawbone, it takes usually about 3 to 4 months for the bone to integrate to the titanium surface. It's similar to when you break your arm. They put you on a cast for a couple of months to stop you from moving, and the bone kind of fuses to each other. So it's the same concept. So after that period of healing, we essentially we go into the next stage of the treatment, which involves making the crown. And it's that crown that does the actual chewing,
Yes.
and that's the thing that's actually visible when you smile. So after a few months of healing, we take a mold, just like when we would normally do a crown of the tooth. We would then make a crown on an abutment. An implant and a tooth is a little bit different to each other in that the implant has an additional component called an abutment, which is an intermediary connection that connects the crown to the artificial root.
I see.
Yeah, and the crown gets cemented on top of the abutment, and those two together will be screwed into the artificial root, and that's how the crown becomes functional.
Okay, so it's like an adapter. Right?
Exactly.
Adapter, like when we take 220 to, like when we come here, then we need an adapter to plug it into.
Yep.
You need that intermediary.
Exactly.
Okay. So here's a question that I wanted to ask is, I mean, you said there's like 3 months of wait usually. Is that 3 months? Because a lot of ads, or they market like teeth in a day, like they actually market that you can restore your missing teeth in a day. How is that possible if you have to wait the 3 months?
So the biology doesn't change. It comes down to whether we have good stability. So when we place an implant fixture into the jawbone, we can assess how stable the implant is based on the torque value as the implant that the implant engages the bone. And if we do have a good stability of the bone, then we can make a temporary on that same day we place an implant. But as I mentioned previously, the biology doesn't change.
Right.
So you still need to be careful for the next 3 months not to function a lot with it, because one of the reasons why the implant would fail in the early stage of healing is immobility. So if you use that temporary tooth during that early phase of healing, the bone cells will not be able to fuse to the implant surface, and that's how the implant fails. So it's a good solution for patients who are missing all the teeth. Then sometimes we can do a teeth in a day, or for front tooth, sometimes we can do an immediate tooth on the day we place an implant. But prosthesis that will need to be upgraded to the final prosthesis after the healing is complete.
Okay. So like initially, Dr. Hunt, you mentioned about like different ways to restore missing teeth. You said dentures, bridge is an option, right? So what sort of sets implant apart from all these other options? And what are the main benefits of dental implants?
So denture is a removable solution. It's a thing that you sometimes see in your grandparents' house, where you put a removable appliance that you put in a cup of water. So that's a denture. It's a cost-effective solution, but it's removable and it needs to engage on the other teeth. So it's bulkier, it's not as comfortable. Also, when you eat with it, sometimes it can implant, once it's actually integrated to the bone, it doesn't move, and it's a fixed solution, the one that you don't need to remove. Now, comparing, a lot of people do ask what's the difference between a dental bridge and an implant. Both are fixed solution, but a bridge involves putting crowns on adjacent teeth to stabilize the bridge. If you imagine, in order to create an artificial tooth, it can't float in the air. It needs to be supported by something. With a dental bridge, it's supported by the adjacent tooth. So we shave the tooth and make a crown for the adjacent tooth, except there's an artificial tooth that's connected to that crown. So that's a dental bridge. Whereas with an implant, we don't touch the adjacent teeth. We only work on that missing side. Doing a dental implant can be a more conservative treatment option than a dental bridge.
Basically, like, so implants don't touch the adjacent teeth, right? So it helps to preserve more tooth structure, right? You don't have to unnecessarily shave your other healthy teeth. You can just fix the missing part, basically, right? So then what are sort of like the criteria for an implant? Like, can anyone get it, or?
So with dental implant, age is one thing. As an orthodontist, you would commonly see patients with missing laterals. And for young patients, we like to postpone dental implant as much as possible, because as they grow, the jawbone also grows. So we want to wait until the growth is complete before we do dental implants. So we would do an interim prosthesis such as a bonded bridge, which is a different, more conservative bridge option as an interim treatment until the growth is complete. So age is one factor. Another factor is the medical condition. There are certain medications, certain medical conditions that can hinder with the healing of the bone. And one of those would be, for example, an immunosuppressant, or if you are on medications or injections for osteoporosis, then that can affect the proper healing of the bone, and that could be a contraindication to an implant. And the third thing that we need to consider is the amount of bone and the gum that's available. And the bone can be assessed, and the amount of the bone can be assessed using a cone beam CT scan, which is a 3D X-ray. If you don't have enough bone, that's when we need to create more bone by doing additional procedure called bone augmentation or sinus lift.
Okay.
And same with the gum. If you don't have a lot of gum, then we need to do an additional procedure called gum graft to improve the gum volume. And that's altogether bone graft and gum graft in patients with deficient bone and gum volume. You can have a good prosthetic and surgical outcome by doing those additional surgical procedures.
Okay. So, I mean, you still have that limitations regarding like the timing of it. I mean, if you're actively growing, obviously you don't want to place an implant, but you want something to cover it up during the time. Another thing that from orthodontic perspective that we can do is to put a fake tooth in the retainer.
Okay.
So we can put fake teeth inside the clear retainer. You just pop it in and people don't think that you're missing teeth.
That's
so
an
you
option.
can use that as an option. Or during the time that you have braces on, we can actually put fake teeth on the braces themselves. So when they smile, then you don't have to be awkward, right?
That's correct.
With those big gaps. So then what about like, let's say healing wise, I think a lot of people are interested to know about like, is surgery painful? How much time do I have to dedicate? Like, do I have to actually take time off from work to do implants and things like that? Yeah.
So it comes down to how much bone and the gum you have available. So for patients who have a good amount of bone and gum available, then implant procedure can be fairly painless and recovery is quick. You can go back to work the day after with minimal swelling and pain.
Yeah.
However, there are certain cases when you do additional procedures like bone graft and gum graft where you can have a bit more post-operative pain and swelling. And obviously your dentist will explain what the post-operative recovery is going to be like prior to surgery. But if you do need those procedures, then the recovery can be 2, 3 to 4 days, just because you can have a bit more swelling and discomfort.
Okay. So, I mean, but it's minimal, right?
It's minimal.
For most cases, you don't really have to take like 2 weeks off from work or for implants.
No.
So while it's surgery, it's not like surgery.
No.
You don't need to be like under usually. Right?
All the cases, or most of the cases, can be done under just a local anesthesia.
Yeah.
Frankly speaking, I think patients have better experience with dental implants than taking a tooth out.
Right. Extracting a tooth.
And same with the post-operative recovery.
Yeah. So I think one last thing that we want to talk about is how does orthodontics and sort of implants interplay? Because I do get patients from dentists and Dr. Han to come to me, and sometimes patients are wondering, why do I need braces consult or Invisalign consult before an implant? And here's the thing. For instance, I mean, for an implant to be placed, you need good sight, right? You actually have to have an adequate amount of space to place an implant. But sometimes when you're missing teeth, then the teeth tends to tip over and the other teeth are sort of intruding on the dental implant site.
Exactly.
So we can use limited treatment orthodontics to sort of make that tooth a little straighter so that they're like parallel, and now you gain more space for that implant to place perfectly, right?
That's correct.
So if you don't have a proper adjacent teeth, then it's really hard to jab in a really good ideal implant in that space. So I think that's a point. And a lot of people ask me, then is it gonna take like 2 years, 3 years to finish my treatment? No, if it's a limited treatment targeted to create an implant site, it usually takes no longer than 3 to 6 months. So I think it's an added value. If you're gonna get an implant that's gonna last you 20 plus years, you're gonna keep it there for a long time, you might as well do it properly. And it's, yeah, so right?
Yeah, I mean, I totally agree, and it's
Yeah.
a good point. And another thing that I just want to point out is that for patients who do have severe misalignment and like severe crowdings, a very deep bite, then it's also going to put a lot of stress on
Right.
dental implants or any prosthesis that you
Yes.
put in, and that's going to reduce the lifespan. So if we can improve that overbite and improve the alignment of the teeth, that will also improve the prognosis and the lifespan of the dental implant that you put in. And orthodontists play a very important role in creating that site.
So in simple terms, I would say like the foundation is really important before building a house. So orthodontics, and like you mentioned, if the bone's not enough, you could do a sinus lift or bone augmentation procedures to sort of get that foundation ready before you build yourself a house. Imagine building a house on a slant, or if you have like a poor sandy soil, or I'm not an expert at building houses, but still you can imagine, right? Then the end result won't be as ideal as if you have a solid foundation. So I think, yeah, this is very interesting, and for me too, it's really good to sort of hear from the expert in implants. So yeah, so if you guys have any questions or comments or questions or about your missing teeth or anything, you can leave it down in the comments below, and we'll be back with a more educational, more fun episode with Dr. Han. So yeah, that's it for today. See you guys next time.
See you.